Hi guys, welcome to Modish Social Connections. It's so good to have you all here for today's session. So every time we try to touch a topic which has some way or the other affected your lives during this time, and we are trying the most we can to make sure that we solve out all your issues. And today's session is one such session where we have a very special guest with us. Dr. Tripat Choudhary. I'm sure most of you must be aware, but for those of you who are not, Dr. Tripat Choudhary is a leading gynecologist from Delhi, and today she has agreed to take out time and come here for the session. She is going to be talking to us about COVID-19 and how it should not be a very big problem for everyone who's pregnant, because pregnancy in itself makes us also paranoid and in itself brings so much stress. So we thought that there can be no one better than Dr. Tripat Choudhary, because she's a very positive person. She makes your pregnancy a breeze of fresh air. So we have decided to call her here. She is going to answer all your questions. Plus we have few more questions that we have to ask her, which are not related to pregnancy, which are mainly about the vaccinations and the tests that females should get done in their 20s, in their 30s, in their 40s. So we all usually end up missing all those tests. So that is one thing that we are also going to touch. So I'm just waiting for doctor to come here so that I can make her a part of this conversation with us. And previous sessions have also got some really good responses from all of you, and all the videos are shared on IGTV. We've had session which was with pediatrician Dr. Nitin Verma, who spoke to us at length about the precautions that we should take and we can take for the kids. And then we had a session with Harleen Bhasin, who's a very well-known nutritionist in Delhi, and she spoke to us about the diets that we should follow while we are sitting at home. So we've had many of such informative sessions, and you can go through all those sessions on our IGTV. I'm just waiting for Dr. Tripat to come and join us today for the session, and she's going to answer all your questions. So hi everyone, how are you all? So good to have you. Hi Cherry, hi Mom, hi Saisha, hello Sakshi, hi Mahima, hi Aishwarya. Hello everyone. So good that you all could join here. I am just waiting for doctor to come and join the video so that I can make her a part of this video. Hi Priyanka, how are you? Mahima, may I request you if you can just call up Dr. Tripat once and ask her to join the video. Hi. Hi everyone. Yes, I'm doing well too. Also guys, we got many requests from people that they could not access the IGTV videos that we had recently posted. So one thing which is very important to point out here is that kindly update your apps, your Instagram apps, and then you will be able to see all the IGTV videos that we've put. So that was the main glitch, and we figured it out somehow, because we were getting many requests from people who were telling us that they're not able to see the videos. Yeah. Hello everyone. We are just waiting for Dr. Tripat Choudhary to come and join the video. I'm sure your wait is not going to be long. Why don't you, some of you people, just come and be a part of the video. Let's see what you have to say about Dr. Tripat. If there's anyone who wants to be a part of this video, can send me a request. Okay, so we've just got a message from Dr. Tripat. She's going to be joining us very soon. We have Dr. Tripat Choudhary with us, and once I get a request, she'll be a part of this video. And all your wait is going to be over. Yes. I have.
लाइट ये नीचे ऊपर की लाइट करिश्मा
Hi, doctor. How are you? I'm good, doctor. It's so good to see you, like always.
आई थिंक आई बेटर
Yeah,
थैंक यू सेम
I
हियर
can see you now. It's always a pleasure to see you, and I think we should have more of these sessions so that we can get to see you more.
सेम हियर आई गेट टू सी यू टू
One of the saddest parts about delivering a baby is that I don't get to see you that much, which I really miss.
so we'll do these sessions, more of these sessions.
Yes, we have to do these sessions. So, for all of you,
Yep.
I'm sure mostly all of you know who Dr. Tripat is. She needs no formal introduction. But for all those who are not aware, Dr. Tripat is a leading gynecologist from Delhi. And she is also my gynecologist. And I am so proud to say that she's made my both pregnancies a breeze of fresh air for me. And thanks to you that, it all seems so nice and so relaxing and nothing else matters. So the reason we wanted to have you, doctor, is because you are such a positive person. You make us feel so relaxed. So this time we really wanted you to come and make it more relaxing for all the people here.
So
Yeah.
let's shoot.
Yes. So, doctor, coming to COVID-19, as you
Yep.
know and we all know, that the overall perception of the disease is such that we are all really scared. And we don't know what to do. We don't know how to go about it, how to prevent it. So, do you think it's all the more serious for pregnant women, or it's equally scary for them as it is for any one of us?
Actually, I think the fear of the coronavirus is much more than the danger of it. We must understand that this is just like any other flu. It's just that, all viruses undergo mutation and new forms keep coming. So we don't have a vaccine against it. And also, it spreads faster than a lot of other flus. So that is the thing. Since it spreads faster from person to person contact, it's so much faster than other viruses. Although
Yeah.
it's less dangerous than the SARS virus or the swine flu that everybody knows. Actually, the mortality of swine flu is more than that of coronavirus. But it
Yeah.
spread from one person to other people is less, and that's the difference between them. So we don't really have to be scared of it. What we have to do is take precautions.
Yeah.
Since it spreads so fast, we have to avoid the spread. That's our duty. It's our,
Yeah.
for people who it's our duty to prevent spread, and it is in it's our safety not to in our safety we should avoid, take certain measures so
Yeah.
that we don't get it. So and these measures are so simple: wearing a mask,
Yeah.
washing your hands, whenever you touch anything, just sanitize your hands. You go out of the house, you come back, please sanitize your hands. Very important is to avoid social distancing, avoid contact with people, because we
Yeah.
don't know who is a carrier. If
Exactly.
somebody, we will, there are, and of course, we avoid sick people. We avoid somebody who has running temperature, coughing. We avoid those people, but we keep our contact with other people minimal. because
Exactly.
when we, yeah, so we keep the contact with these people minimal, so that, because we don't know who is an asymptomatic carrier. That's the
Exactly.
only, that those are the precautions that we have to take. Now coming to pregnant women, pregnant women belong to an age group, which in which, if were they to get, they are immune, they are as, a pregnant woman is as prone to coronavirus as any other girl her age. So it's
Okay.
not that she's pregnant, so she's more prone to corona, but
Yeah.
it's just that she's just equally, just like any girl her age. And the thing is, she'll be able to fight it like any, were she to get it, fight it like any other girl. So
Okay.
one doesn't have to, yeah, because you're pregnant, it's not that you're more prone to it, you'll get a much worse disease. No. And the fortunate part being that since pregnant women are all young, they will, if they get it, they will be able to fight it. Then the
Exactly.
biggest fear that every girl has is, were I to get it, what will happen to my unborn baby?
Exactly.
The
Yeah.
good thing about coronavirus is, it does not pass. If a girl were to get it, she will not pass it on to her children, to her
Okay.
unborn
So that's
baby.
the relief for everyone,
It's
I
a
hope.
big relief for any
Yeah.
pregnant woman that, God forbid, were she get corona, she is not going to pass it on to her. So the
Fetus.
precautions
Yeah.
in all trimesters are the same.
Okay.
That, to avoid getting the infection, wear a mask, maintain do hand hygiene, exercise social distancing, avoid sick people. That is
Okay.
it. And then another question that a lot of girls do ask these days is, because labor is long, should I just go in for a cesarean section? No,
Okay.
cesarean section during coronavirus epidemic should only be done for medical conditions, as it is in other cases. So if
All
there's
right.
no medical reason to do a cesarean section, one shouldn't do a
One.
section,
Correct.
just because uh, the corona epidemic is on.
All right.
ठीक
So
है?
that's
हाँ.
relief for everyone, I'm sure. And the precautions, like you're saying, is like for any other normal, healthy human being, is the
like
precaution that
like
you're
for
taking.
any other person. Yeah.
All right.
But
So,
were a COVID positive mother to deliver, then it is better that the baby, it is preferable that the baby is kept in the nursery
okay.
and not in contact with the mother, because she can pass it on to them. But if the mother really wants to keep the baby in the room, then there should be at least a 6 feet distance, a 2 meter distance between the baby and the mother.
All right. All
So
right. All right.
Khushbu, Anega, Swati, hi everybody.
So many people were your patients, and everyone's been messaging me that she's my
They're
doctor. I
all
was like, she's my doctor.
they're all my girls, and now
Yeah.
joins Prerna. Huh?
Yeah.
So that's it.
Yeah.
So they keep a 6 feet distance.
All
And
right.
as far as feeding is, a woman can, a COVID positive mother can breastfeed her baby. The
Okay.
safest way, the safest way to do it is, take a sterile pump. Do your hand. The mother does her hand hygiene,
Okay.
cleans her breasts, and pumps the milk. And
All
this
right.
milk is fed by somebody else to the baby.
Okay.
Okay. But in case a woman decides that she would like to directly breastfeed the baby, in that case, she uh, does her hand hygiene, she can wear her gloves, clean her breast, and feed the baby directly, knowing
Okay.
fully well, because in handling the baby has a higher risk of getting the infection than if the baby was given pumped and expressed milk with the bottle.
So if the mother is COVID positive, that is. Otherwise,
That
she can
only if
normally
she's go.
test.
Otherwise, otherwise pregnant. If she is a, otherwise she has to do nothing. She's like in the under these conditions, she just goes through pregnancy and labor and breastfeeding, just as she would do in other
Oh.
conditions.
All right, so that's a very good news. I hope for everyone out there. Coming to the next questions, doctor. So basically, ultrasounds are a very important part of being pregnant. So
Yes.
are there any ultrasounds which are not so important to get done at this time, or all are
Yes.
equally important?
No. See, the thing is that what is our first? If the first ultrasound is what we call the dating scan to really know whether the dates we are calculating are exactly the age of the pregnancy. So
Exactly.
if a woman is not having any pain, any severe bleeding, this ultrasound can be avoided.
Okay.
Okay. But if in case of any bleeding or pain, bleeding is to know the status of the pregnancy, and pain, so that we don't miss out a tube pregnancy, an ultrasound should be done. Otherwise, the first ultrasound can be done at 12 weeks.
All right.
That is what we call the first trimester screening test, where you may measure the neck, nasal skin, the neck thickness, and do a double marker or nifty or NACE test to look, to rule out certain genetic disorders like Down syndrome.
Exactly.
And this can also be her first visit to the gynecologist.
Okay.
Before that, if she wants to consult, then we're doing a lot. I'm doing a lot of online consults.
All right.
So you can contact me. This is when you must make a visit. Get all these tests done, make a visit, so we know. And the next ultrasound is the one we do at 18 to 20 weeks, or we call it the anomaly scan or the level 2 scan. Here, the
Exactly.
baby is well formed, and it's a big enough size for the ultrasonologist to see that there are no defects, and
Exactly.
and this ultrasound should again be done.
All right.
And again, this also warrants a visit to the
Doctor.
gynecologist.
Gynecologist. All right. So level
After
one and
that,
level two.
level 1 and level.
Yeah.
After this, a couple of consults may be done on the online. But like I personally, after 28, 30 weeks, I like to see my girls, to touch them, to that gives me a lot of comfort, and I'm sure it gives the girls a lot of comfort also,
Exactly.
so
Exactly.
that uh, they are to they meet with you, because this is the time when some problems may come up as far as the size of the baby is concerned, as far as blood pressure, etc. is concerned. So this is the period when things may come up. So 28, 30 weeks is the men, from, and then from there on we do a regular follow-up. Of course, you know when visits are 2 weeks, we can make it about 3 weeks. Or when it's weekly, we can make it 2 weeks, depending on the status of our patients. And in case we pick up any problem, then to follow her up like we would do in any other
In
case.
normal situation. Yeah, because last time I
So these two
remember.
ultrasounds must be done,
Yeah.
and the
Okay.
rest depending on how the obstetrician feels.
All right. All right. Because I remember when you were not keeping well during my last pregnancy, and I could not see you. So even I was not liking the whole feeling of not being able to meet you. So I can totally
Not being,
understand.
yeah,
Yeah. Yeah.
yeah.
So these are the ultrasounds which are important, and this is the time when you start meeting the patients. And apart from that, you are doing telephonic consultations and online consultations.
Online, yeah, actually, till the coronavirus epidemic came up, uh, the courts had ruled that online consultations are illegal. But after
Okay.
the coronavirus, that is, and now it is that they have become the norm actually.
Okay.
Wherever it can be avoided, that the patient comes for a physical consult,
Hmm.
uh, those, we are doing online consults. So much so that or there are like even their antenatal classes, the Lamaze class and all that, They are
Yeah.
being held online. Exercise classes are being held online. Yoga
Okay.
classes are being held online.
Yeah,
Yeah.
everything is online now. Yeah.
All this is being done online.
So all this must be so different for you as well. Like you have also never gone through such a situation before in your lifetime, and obviously things have changed drastically in the past few months.
Yes. Uh, like, I think in the, I really didn't mind switching over
Okay.
because maybe mine is a specialty where, see her. I
Yeah.
mean, you can advise her and things like that. But then there are fields where you have to actually see the patient, touch the patient. Those situations you
Exactly.
can't probably do from online.
That's true. That's very true. Okay, so doctor, coming on to the next question. So there were people who were trying to conceive. I'm sure there were people who were coming to you who were trying to conceive. And Corona is here to stay. We don't know till when it's gonna be there. So do you think it's the perfect or the right time for people who are trying to have a baby to carry on doing it? Because they have to restrict the number of doctor visits, the ultrasounds, and everything. Obviously, there's an inconvenience associated with it. So, do you think it's the right time to conceive, or they should, delay it a little bit more?
Uh, it isn't necessary to, the way I'm looking at it, I find this thing very positive for baby making.
Okay,
You,
really?
your generation, see, a lot of husbands and were traveling, or wives were traveling, or they
Yeah,
were doing shifts at odd hours, and the two of them never got to meet.
exactly.
And if they did meet, they wanted to have a nice time, they wanted to, party at night.
Yeah,
No, it's true. uh,
yeah,
I mean, in your generation, there's a lot of, it was work hard, party hard culture.
exactly.
And to and people did, whether if either because of work they didn't get together, or they because of when they were together they went out and all, they came back so late, they just didn't have the energy for each other. So now, they're not nobody's traveling, has at work, and there's no partying. So the couple, the husband and wife are being thrown together. And we
Exactly.
have had quite a few pregnancies where people had been trying for some time. And
Okay.
the stress of ये वाला ultrasounds, medicines, doctor's visits, ये time ठीक है, वो time ठीक नहीं है, this is wasn't getting them anywhere. And now just random frequent sex has made so many people
Yeah, conceive.
conceive. So
So
it's
there
really
is a
hard
positivity
for
attached to it.
yeah, for people who need assistance, as we called, uh, artificial reproductive techniques like IUI and IVF and all that. So there, follicular ultrasound monitoring is required, which is a number of visits. So people, it's better that all these visits are avoided, both for the patient and also to decrease the load on the radiologist. Because then so because of social distancing, the time taken per patient is so much more. Because every time a patient, before a patient, the first patient comes, the room is sanitized, the bed is sanitized, the machine is sanitized, and the patient comes, that patient leaves, the bed,
Whole process.
everything sanitized again. So it takes a lot of time. And whatever is, and why expose yourself or the healthcare worker when it's not necessary?
Exactly.
One could always wait for a few months when this thing, a lot of us by September, October, people say 70% of us herd immunity. So the the patients will have developed immunity, the doctors will, the healthcare workers will have developed some immunity, and I think we can carry on from there. So
Okay.
natural conception, there's no problem. But as far as assisted reproduction is needed, I think you can wait for a little while when exposure to exposure to other people, when the maybe the disease process is settled a little, or we there's so much immunity in the community that we already have our immunity, and we're not going to be getting infected or giving infection to others. So that's important.
So you are suggesting that natural conception should be
Natural
encouraged
conception
and
is no problem at all.
all
I
right.
think one should just go. And it's actually, we were joking the other day, aajkal kaam kam hai. Let us
Hmm.
gear up for December. So that's it.
Yeah, but I was also thinking that, for you, I think the things remain the same only because whosoever was pregnant is still pregnant, and obviously people cannot stop coming to the doctor. That
Yes.
is one thing. So
But
for
we
you,
have decreased, yeah, we've decreased the number of visits. And, the hospitals are taking precautions. Uh, like there are, all doctors are taking fewer appointments, and for whatever you do, social distancing is, you give
yeah,
your travel history before you enter.
okay,
You, you sanitize yourself. Your temperature's checked.
all
Distancing
right,
is maintained. Appointments are more far apart. Seating between patients is more
all right.
far apart.
So the
And
whole
only one
process is a
visitor.
lengthy one.
Yeah. We tried that there was no attendant in the outpatient, but then, the husband wants to be there. But
Yeah,
when you get admitted, you have your COVID testing done. And uh, only one attendant is there who checks in with you and checks out with you. So the
all
husband is there. So at this point
right.
of time, a lot of people are going in for, like um, a doula service, as they say. That
Yeah, I've heard that term, but I think in foreign countries it's used more. The
no, it's
doula.
coming. Like the husband is alone, and the way our boys are brought up, nicely pampered, half of them will faint during
Yeah,
delivery.
yeah,
So there you one could have a professional who will be with you from the minute you enter the uh, hospital labor room
hospital.
till you deliver, and then of course assist you with your breastfeeding and everything. So
All right.
that is, it's like, your mom or your mother-in-law can't be there, so this person helps you with
Okay.
everything. A professional helps you out with all these things.
Saisha here is saying, doctor, that how to meet you if we don't want more babies.
How to meet me?
How to
हाँ,
meet you if
हाँ,
we
अब तो
don't want more
पार्टी
babies.
अब तो पार्टी भी नहीं हो सकती. come
Yeah.
come meet me. I have an open
Anyone
house.
anyone who meets you falls immediately in love with you. So I'm sure that's
Thank
the question that everyone wants an answer to.
thank you so much. Thank you.
Yeah. All right, doctor. So, from being a medical professional, do you think things are being handled like properly in our country in terms of the PPE kits and the masks availability and the ventilators and everything? Do you think it's going as it should be?
See, people are saying, देखो क्या किया, लॉकडाउन किया, अब तो, और अब जब केस बढ़ रहे हैं तो खोल दिया. See,
Yeah.
lockdowns never decrease the number of cases. They only push the curve back. And, like, let's give credit. I think our government was well aware that it wasn't equipped for a big epidemic if it happened in March.
Yeah.
So the lockdown actually gave them time to prepare. See the number of companies that have gone into making PPE kits and masks and ventilators is tremendous.
Yeah.
Today we are probably much better equipped than we were in March. People will say, "Abhi bhi kitna preparation hai?" People are, but please, just look at our population. We can
Exactly.
never meet their demand.
Exactly.
That is
Exactly.
it. We can't ever meet that demand. Where education, healthcare, jobs, and this falls into this. It's similar. The numbers just beat us. So no matter how much preparation we have, we can't. It's very difficult to be able to provide services for everybody.
Exactly. That's very, very true.
Yeah.
Yeah, because people are comparing India to Germany and whatnot, and obviously
Look
the
at
population is there's a
so small.
drastic difference.
Yes.
Yeah,
Yeah, we have to just see the difference. And if you
yeah,
say China mein ye hua tha, China, you never know what exactly has happened there.
exactly. China, anyways, has not disclosed everything.
Yeah.
So, Dr. Parul Gulati is asking, what is the first thing to do if you find out you're pregnant?
First thing to do if you find out you're pregnant. And how do you find out you're pregnant?
Probably with the test.
With most girls do a home pregnancy test.
Yes.
Yeah. So the moment you do a home pregnancy test and you find out you're pregnant, do a blood test and get in touch with your doctor.
Yeah.
Confirm it with a blood test and get in touch with your doctor. Even if you can't go to see her, like I said, online consults. Like me, a lot of other people are also doing online consults, and you
Yeah.
can go see the doctor. Yeah.
So, doctor, are hospitals the safest places for gynecologists as well as the pregnant women who are getting admitted? Like, do you think the protocols are being followed? At least in
Yes.
the hospital
Yes.
that you go, I'm sure they are. But
Yes. See,
like
we are
overall,
fortunate that it's a women's only hospital.
exactly.
So all
Yeah.
the it's easier. We don't have people coming in with fever, this, that, cough. So it
Exactly.
becomes difficult to find out who is COVID positive, who's not. So, and the numbers are also less. So it's
Yeah.
making it, that way and all hospitals are trying. I mean, at least in our place, we see. So if most patients are coming in with a test to say they are negative, in case they are not carrying one treats them like a suspect till their report comes.
Yeah.
And so that in case any of them is positive, we are not spreading it to all our healthcare workers and other staffs, other
Yeah.
patients who are there.
Yeah, because I'm sure LAFM anyways is a mother-child hospital, and obviously
Yes,
you
yes,
don't have walk-ins like that.
yes, yes.
Yeah.
Yeah.
So, which age group of women is most at risk of contracting coronavirus?
It's not a question. Anyone can contract it once you
Okay.
come in contact with the patient. But which is the age group which is most for whom it's dangerous, and that is my age group.
Okay.
See, yeah, women above 50, especially above 60, they are the ones. Also, women in the older age group and women with comorbidities like
Yes.
diabetics, hypertensives, asthmatics, people with lung disorders, heart disease, diabetes. But in those people, this is more severe and life-threatening. Otherwise, in young people and children, it's of it's they have the ability to fight it.
Yeah. So it's basically riskier for people of a little higher age, and also for people who
Of
have
the older
underlying
age group, of
diseases.
the older age.
Yeah. Kuvar Singh wants to know
Yeah.
if there are any side effects of COVID-19 on the unborn baby. I think he's missed the session before. So,
You know,
doctor, can you just
yeah.
quickly tell it to him?
Yeah, see, the thing is that if we have a COVID-19 mother, we isolate the baby in the nursery,
Yeah.
but the mother can still feed the baby by taking all precautions while expressing milk with a breast pump, and this milk can be fed to the baby by somebody else.
Yeah.
Uh, if a woman decides to keep the baby in her room and breastfeed the baby, she takes all precautions while breastfeeding, understanding fully well that the risk of the baby getting COVID-19 is more than if the baby was isolated
Yeah.
and uh, bottle fed by somebody else.
So overall, it doesn't cause any side effect to the unborn baby.
No, it does not.
Yeah. So Payal here is asking, doctor, what age should the cervical cancer vaccination be given to teenage girls?
Okay, cervical cancer vaccine has 3 doses given at 0, 2 months, and 6 months. The best time to give it is after the age of, what we call primary vaccination. Uh, Between the age of 10 to 13, it should be given.
Okay.
And supposing it's not given at that age, then we say catch-up vaccine, which is given before the girl becomes sexually active. So
Yeah.
this is catch-up vaccine. If a girl is sexually active and she still wants the vaccination, I, up till the age of 26, it may be given, but I don't like to give it after that, because this the cervical cancer vaccine is against the virus HPV. The
Yeah. Yeah.
HPV, it's so this virus infects the young cervix,
Okay.
and after that, either it stays in your body or it is washed. Your body fights it and washes it off. So,
Okay.
like a lot of people give it after childbirth, this, that, 30 ko bhi, 35 ko bhi, 40 ko bhi. I don't believe in that. Uh, I,
Okay.
I feel that you've either got it and washed it. Either you never got it and you're not likely to get it, or you washed it off, or you are carrying it and the vaccination is not going to help you in any way.
Yeah.
So that is it. But one
All
must
right.
understand that even if you do take the vaccine, you should have your pap smears like somebody who hasn't had the vaccine. The
Okay.
vaccine only protects you against two very dangerous strains, the 16 and 18, but it does
Yeah.
not protect you against all the strains. So it
Okay.
is better. So you get yourself routinely checked like any other patient.
So, what is the gap that we should take between the Pap smear to get the
Okay.
Pap smear done?
See, if you are only having the liquid-based cytology or the LBC,
Yeah.
uh, we it should be done annually for at least 3 years, and then every 3 years, provided it's negative. But I
Provide.
find, in our population, it's very difficult to. Abroad, a girl will come on her own. Here, it's very difficult to catch hold of you girls. So what I do
That's
is
very true.
I do the LBC along with the high risk HPV, and with that, there can be a gap of 3 to 5 years. Because
Okay.
if the LBC and the high risk HPV are both negative, you can have a smear after 3 to 5 years because you belong to the low risk category. But
Okay.
if either the LBC or the HPV is positive, then we call you immediately, we follow you up till we know that, okay, there is a problem or no problem. And if there
Yeah.
is no problem, but you fall into the high risk category and you need to go through your smears, your PAP every year.
Every year. Okay.
Yeah, if either your LBC or your HPV is positive, go through a PAP smear, PAP every year. But
All
if
right.
it is negative, then you do it in 3 to 5 years.
All
Then you are not wasting the patient's time. You're not wasting your own time. You're constant, and once you explain to the girl, she will come. Then this girl will come regularly. That she's
exactly.
in the high risk category, she'll come regularly. And I am concentrating my energies on somebody who needs the attention. I'm not wasting it on somebody who doesn't need who's
Who
in the low
doesn't?
risk category.
Exactly. Yeah. All right. So people who fall in the high risk even once should consult the
Yeah,
doctor
then
regularly.
then again there is a protocol that after we are following them up, if for 3 years they are negative, then they fall into the low risk category. There's a proper set
Okay.
protocol and we follow.
All
There's an A logarithm which you follow.
So I'm glad I had this discussion with you because after my first delivery, I think I had a positive, and then I got so scared I didn't come back to you. And then after my next delivery, it was negative. So then I again thought that I'll not go back to this because I got so scared.
Yeah, no, yeah. So this is it.
Yeah. All right. So Dr. Neha here is asking, I'm worried if I get back to office, I might carry infection back home to my kids. So what do you suggest?
See, for that, for people going to work, when you come in, please wash your hands, sanitize your, take your shoes outside the house,
Okay.
sanitize your hands, have a bath, take off your clothes, and give them for washing.
All right.
That's it.
That's all. All right.
So if
Pooja here is
anything has come
asking.
onto the surface, it gets
Yeah.
washed off.
All right. So Dr. Pooja here is asking that what are the precautions to take or recommend during the early stage of pregnancy?
Oh, you're asking to the wrong person
Why?
because I to say have fun.
Yeah, that's exactly what I told my mom. I was like, doctor's gonna say you have
See,
fun.
the thing is that my mantra is continue to live life as you were doing before you became pregnant.
Yeah,
That is it. Because at the end of the day, you know, you can't restrict life, and nothing that you do is going to affect the pregnancy. Of course, x-rays and medications and all that you have to take care of. And I
exactly.
always, on the first visit, I give the patient a list of medicines that they can safely take. Otherwise, uh, one avoids, if one is taking any new medication, one consults the doctor before taking it. But for
Yeah,
minor ailments, usually I provide them with a safe list that they can use throughout pregnancy and lactation. And avoid x-rays, etc. And also, avoid, as far as food is concerned, avoid raw meat, raw
yeah,
fish, and
yeah,
also any soft cheeses, which where it may not be pasteurized,
exactly.
and one can carry infection. And one should have fully cooked eggs.
Fully cooked
It's
egg.
just to avoid certain infections.
All
That's
right.
it.
So that was
But
anyways the
otherwise, whatever
protocol.
we may do is not going to affect the pregnancy. Uh, it's just that either a pregnancy is good or it's not good. And if it is good, no matter what we do, nothing's going to go wrong with it. And if it's not good, no matter how many precautions we take, it's not going to become better.
Exactly.
So that's it.
That's exactly the best way to put it, I think.
Yeah.
Yeah.
Just enjoy the pregnancy as much as you can.
Yeah, so I hope you got your answer, Pooja. Dipesh here is asking, my friend is due to deliver next month. There is an undercurrent of paranoia and stress while we are trying to keep positive. Any words of advice?
See, this is a flu like any other flu. It's not going away. We'll have to learn to live with it. This is the new norm.
Yeah,
Just take all your precautions and avoid, like I said, mask, wash. Just avoid contact with people so that you avoid getting it from somebody. That is it. And like I said, you you as a young person, avoid getting it first. Prevention is
exactly.
of course the best, but were you to get it, you're better off. Your age group only helps you.
Exactly.
You're not going to be sick. It may be just a mild infection or asymptomatic infection. It isn't going to affect your baby. So what are you worried about?
Yeah. So it's best to keep positive because it's not
Yes, the
early.
people, the people we should be worrying about is our parents who have any comorbid parents because of their age or comorbidities that they may have developed, our grandparents. Those are the people to be worried about. Young
Exactly.
women will fight it.
Doctor, today we have lunar eclipse, and obviously there's a myth that goes along with the eclipses that pregnant women should not do certain things, and so incidentally, it's happening today. So we just want to know: is it actually true that it affects the pregnant women more than normal
No,
people, or
as of now, we haven't linked any eclipse, lunar or solar, to anything with pregnancy. But it's
yeah,
been carrying on from grandmother to mother to daughter and
yeah,
so on. So, you don't go out, keep lying down, don't eat or drink during that period.
Exactly.
Well, so if it like I tell the girls, if it keeps your mom and mother-in-law happy, just do it, because when you're going to party later on, they are the ones who are going to take care of your baby. So keep them happy.
Yeah. That's true. Oh God, I love everything that you say, doctor. I'm completely mesmerized and honestly totally in love with you.
Thank you, thank you.
So, doctor, can you quickly tell us what are the tests and vaccinations that women should regularly opt for in their 20s, 30s, and 40s?
Okay, see, we must see, like the childhood vaccinations they would have received, and one makes sure that before they are sexually active, they take their uh, cervical cancer vaccine. And I tell people another thing. I say, please give your daughters their vaccinations while they are still in school, because a lot of you send your children abroad, and to have them for 6 months with you is difficult. So I find it very difficult to be able to get their protocol in order.
Yeah.
So just give it. And for women, then like uh, uh, which every girl should, all of us should be hepatitis B. Before any girl is planning a pregnancy, I check for their hepatitis B status. And if
Okay.
they are, if most of them are vaccinated, but sometimes the vaccination doesn't take up, then they should be vaccinated. Chicken pox, and because these are vaccinations that are available, so they should be done. And rubella, German measles,
Okay. Yeah. Yeah.
all these vaccinations should be done before a girl is planning these are vaccinations available, so they can be done. There are other things for which they are not available, we can't do anything about them. And then
Okay.
during, previously we were giving the tetanus vaccine during pregnancy. Now we give the Tdap, which is
Yeah.
tetanus, diphtheria, and whooping cough combination, which is given at 28 weeks.
All right. All right. So apart from that, like vasectomy and other any other such tests which we should get regularly done, and at what age?
Yes, yeah. See, one is that every sexually active woman must visit the gynecologist once a year, so that she tells her complete, the doctor knows her medical history and her menstrual history,
Yeah.
uh, and she has an examination, a pap smear once every 3 to 5 years. If it is normal, if it is not, then you will be given another different protocol.
Okay.
A history of any cancer in the breast cancer or gynecological cancer in the family should be known,
Okay.
because yeah, because if she is uh, if if there is history of breast cancer, then these girls should be the girl has her mammogram at 35. If there's no history, she has her first mammogram at 40.
All right. Got
Also,
it.
then after 35, every alternate year, and from 40, every year. But if there's
All
no
right.
history, then you do it at 40, and you can do it every alternate year.
Every alternate year. All right.
Breast self-examination, one should learn either from the internet or from a gynecologist, and do a breast self-examination every month after once she gets after her period.
All right.
Also, an ultrasound. Previously, ultrasound didn't form a part of the annual checkup. Nowadays, they do, because one of the things that is, one gets to know very late is ovarian cancer. So they say if you do an ultrasound once a year, it's good. You look at the ovaries and feel comfortable about it.
All right. So it's important to usually get all the
I
tests
go to the
done once
gynecologist
a
once a year. She, after
Yeah.
going through your history, will decide कि अब क्या
Will be
करना
fine.
है.
All right. All right.
And so the
Thank you
next
so
time she
much,
might even
doctor.
tell you, get these tests done and come back to me.
Yeah, because I actually did not come back to you after I got a negative response, but now I've decided that I'll be very regular with this.
I
Yeah.
hope so.
Yeah, I hope so. All right, doctor. So, there were many people who could not attend the session right now because it was a working time for them. So for
Mhm.
all those who've missed any answers and want them, because I have a few questions here which were already answered, so you can go through the IGTV video later. I'll be sharing it with everyone. And doctor, it was amazing to have you here. It means so much to have you here.
Thank you,
Like, you
dear.
are the best, the most down to earth person ever. And
Thank
even
you.
talking to you overall gives a very positive feeling to anyone who would
Thank
meet.
you so much. Thank you
So this,
so much.
yes, so this was the primary reason we wanted you, because there is so much negativity around and we
Yes,
want someone like
yes.
you to spread the positive message.
Thank you so much. Thank you.
And we love you. We all love you so much. And
Me too.
yes, and thank you
Me.
again for
You're all
taking
my
us through
bachas.
this. Yes, yes. And we are so
Tha-
blessed to have you.
खुशबू क्यों थैंक यू कर रही है? Okay, dear.
All right.
Lovely.
Thanks again, doctor.
Lovely.
Thank you.
I enjoyed the
Yes,
session, and I got
yes. And
these
it was so good to
lovely
meet you.
messages, lovely messages from so many of my girls.
Yes, it shows how much love everyone has for you in their hearts. Everyone
And
has
me
written
too.
so many good things,
You're
but I
all
will
my
not
little
read out.
girls.
Yeah.
Okay, dear.
But so good, and
Okay.
thanks again, doctor, for taking out time.
Welcome, darling. Welcome,
Thank
sweetheart.
you.
Okay,
Bye.
dear. Bye.